So good afternoon, guys. My name is Shane Lavoie. I'm here with my business partners Jack Nealon and Patrick Cusinelli, and within our volunteer here, Jeff, as well. And we're here today to talk to you about Mass Heartbeat, which is an innovative ECG heart screening service that comes directly to schools and universities to offer a very important test that can help to save lives in the community.
Yeah, so we're here before you folks today, kind of coming out of a tragedy. Shane, Pat, and I lost a good friend of ours. Actually, let's get you the next slide here. We lost a good friend of ours back in 2010 to sudden cardiac arrest. His name was Evan. So, over the past 8 years, we've really kind of understood how frequent these episodes of sudden cardiac arrest do occur. And, it's one thing for us to really focus on that, just here down in Peabody, at the turn of the last year, there was a girl walking out at the end of the school day, headed out to catch her mom for a ride, and unfortunately she dropped to sudden cardiac arrest. Fortunately for her, her family, the whole community of Peabody, there was the principal actually right nearby to administer help. For us it's an issue because there's no process right now that actually detects these heart conditions past going in to get your average physical and a stethoscope. So, we think this is a big issue because these issues are preventable, and there are machines out there, and what we'll show you folks today, that can kind of, bring light to these issues and prevent them and detect them. The next slide, Coos. So at Mass Heartbeat, we really do believe that every student deserves the opportunity to get their heart screened. It's one of those things where there are 1.2 million students in high school and higher education here in Massachusetts, and all of them are susceptible to sudden cardiac arrest. It's not incredibly common, although it is possible to happen to anybody. And we've seen it, through the past 8 years. We've met folks through some of our work in the nonprofit sector, as well as starting this, that they didn't know anything about their son or daughter, and the next thing you know, or a cousin, or there's plenty of samples of this exact type of incidents occurring. We're not really here to educate you folks that heart disease is the #1 killer of all Americans, because we know that. That's been plaguing the United States for years. We are here to let you folks know, though, that sudden cardiac arrest is the #1 cause of death of all student athletes. And again, it's preventable, and we've seen it, and we've identified a process to kind of make it as such. So our process is simple. So what we do in our solution is we've partnered with cardiologists in Worcester, and they play a major role in actually being able to detect these. So what we're doing, and literally right in front of your face here today, is we partnered with nursing technicians. Pat is not a nurse. He is not one of those technicians. He's a co-founder. But we bring 4 nurses into schools, and we screen hundreds of students in a given day. And this is the process. There are 10 electrodes placed across the student's body, and then which is connected to our medical device through these leads, and there are 10 of them. And what it does is it captures a 10 to 15 second snapshot of the electrical current through the student's body. The results are directly transferred back to our cardiologists in Worcester for them to interpret. We're going to be honest, out of 100 kids, there'll probably be 3 students who are flagged with an abnormality for follow-up. But luckily for us, our cardiologists are such believers in the program that they themselves will call the families and the students and figure out next step, whether it's coming in to visit them, or in some of our previous screenings, we've had students go right into Boston Children's and have a procedure. So it's incredibly innovative. We believe that this process is simple enough that it can be created. And as you're seeing in front of you here today, it's a 3-minute procedure where we can screen hundreds of students in a given day.
So Mass Heartbeat is a unique opportunity for the judges here today because we are fully operational, which means that we can make an immediate impact here at the community. So the funding wouldn't necessarily go towards our startup costs. Instead, what we propose is that for $5,000, we would come here to UMass Lowell and screen on campus all students and faculty that are interested, free of charge to those individuals. Instead, the $5,000 will go towards our variable costs, which includes paying the cardiologist a reading fee per screening, paying our screening technicians to come in and screen the students, and also we have a non-profit give-back commitment that we have filed as a benefit corporation. We give back to Live for Evan, which is a non-profit that Jack and myself have also founded. So we really believe that UMass Lowell has a great opportunity here to be at the forefront of heart health in the local community.
Thank you.
Thank you.
So we'll open up for questions now. And this here is a testimonial from, I don't know if I'm allowed to say this as part of the presentation or not, but we have had one screening so far at Hopkinton High School in mid-February. And so this here is a testimonial from the principal of that school about his thoughts on the process and how it went for his students and faculty that day. We screened about 115 people on that day. Thank you very much, Jeff.
Where did your science come from that says 15 seconds is an adequate Holter monitor? Because most cardiologists, it's my business, most cardiologists I talk to want to have a 7-day now or 20 or 2-week, even 24-hour they're not happy with. So
For heart monitoring?
well, just for just a Holter, just a standard Holter.
Yeah, so the Holter monitor is really, it's a snapshot of a day, right, 24 hours. This is really an EKG that you'd get in, if you're being transported in EMT in an ambulance. Again, they're looking at a 15 to 20 second snapshot. And again, the algorithm here, as you see what we can collect, and we're able to collect, volume essentially. That's all the cardiologist needs in order to interpret.
And there's science behind that? Because
Oh, yeah.
that's not the cardiologist I talk to.
Yeah, no, absolutely. This technology was actually developed by Dr. Bagish and Dr. Dresner. So okay, great. So the cool thing about this software and the platform,
Yeah.
it's current, it's updated.
Yeah.
The algorithm itself is based on whatever the most recent criteria is. So we actually just got a software update. So now this is synced up with the international criteria.
And Aaron Bagish uses this exact technology to screen the Harvard Athletics program. Was his most recent study, and he used
It's a Cardia
screen.
2020.
Yeah, and he was actually the one who recommended. We met with him last spring, and he actually recommended this software. And we welcomed it with open arms. Hearing somebody like
Do you
him.
guys have it overread before the cardiologist looks at it? It's only 15 seconds, so it's not that much. So
Yeah, exactly. So again, we're collecting these, and then this is, as we mentioned, transferred over to those cardiologists, and then they interpret it. And to answer your question, this same company they do have a Holter.
Yeah,
They just came out called the Solo.
Yeah.
So again, this is kind of the first line, and then if they need, they kind of implement that Solo.
How much is the cardiologist charge to do a reading?
They're charging about 12% to do a reading on our overall cost, which right now we're honing in on the pricing model, but we're trying to be, what we found is that we need to be flexible with different communities. Some people have restrictions on, what we did in Hopkinton was we passed the cost on through to the parents, but in some other lower income communities we're going to work with the schools themselves and find an area in the budget where it's a $5,000 line item that we then charge any student or faculty member that would want to come in. And based on the volume that we screen at whatever school it is, we pay a percentage fee of about 12% to the cardiologist.
So 12% of what? I be more concrete.
So sure.
Sure.
So it's in Hopkinton, for example, we use $35 per screening
Okay.
passed on to the parents of the students.
Okay, and then the cardiologist charges you 12% of the $35?
Correct.
Correct.
Yes.
Okay, and where do you come up with the $35? Do you have
It's-
a model for that?
No, not necessarily a pricing model. I mean, we actually ended up doing it through Live for Evan a few years ago, and when we realized the demand, and based on that experience, we kind of found the price point that parents would be willing, that we'd hit an acceptable volume at, where parents would be willing to pay this price. It's not $60. It's not too much. It's not too little. So I would say based on trial and error is kind of how we got to the $35. And also knowing that going into a hospital it costs upwards of $150, we wanted to make sure that we provided real cost savings to these families, so that the mass heartbeat screenings provided a benefit to them.
So the cardiologist doesn't have a bottom line amount. So if you decide, with $10, he would just be getting 12% of $10.
No, and truthfully, our cardiologists that we're contracted with, they're not, we say this maybe naively, but we don't think that they're in it for the money. They're in it because they believe in the screening process, and they view this as a way to get out into the community and to preventatively screen for potential cardiac issues.
So what if you set up a day where people came, I don't know, would they sign up and you
Yeah,
have a room
registration
available and you would do that? And let's say you got how many students at the university here? Like 4,000?
However many,
20?
Yeah.
25,000.
25,000,
Yeah.
okay.
that's how many total there is?
Yeah.
Yeah, so I mean.
So what if you get, so again, it's really great that the cardiologist is saying, yeah, I don't have a bottom line, but if you're not presenting them with 1,000 at a shot, let's say 1,000 people roll in,
Mhm.
and you can, I don't even know if you can do 1,000 in a day, but.
We couldn't, no, we
Yeah.
can only screen so many in a
However many
day.
Sure,
you can
sure.
do in a day, they may say, hey, this, this is great, I'd like to doing it on a smaller scale, but you start giving me a big scale, then I might not be able to do it for long.
Right, and that's a fair concern, I think. We have a 5-day business day window in which we get the results back to the students' parents. So I think that buys them a little bit of time where they, depending on the volume, and we can't do 1,000, so say it's 250 or so in a day, they likely can, and there's 2 cardiologists that we're working with directly, they can split it up between the 2 of them, and we
And they're
hope
in
to
a
get it
group of
done.
12 too, so
Right.
they have always said if you guys end up screening, there's a lot of soccer tournaments and things like that. We've explored screening. If we were to get 1,000 over a course of 5 or 6 days, they would bring in other cardiologists and pediatric cardiologists to help read and interpret.
Are you targeting primarily athletes?
No, we actually, and that's a lot of the studies that you read on this is done on student athletes specifically, but we want to open it up to all students, all faculty. Basically anybody that wants to get the test done, we will offer it to them. We don't want to, we're not in it for a study, we're in it because we believe in screening, so we don't decipher between a drama kid or a baseball player or something like that, so.
I don't mean to be using up all the time, but just like following up from that. So, again, it seems like it's great, and why wouldn't everybody take advantage of it? So then we get into the logistics. So how do you just accomplish that with such a large university, large scale numbers? Even in a high school, you're dealing with thousands of students.
Sure.
So if you're opening it up to everybody, how do you deal with the logistics of being able to accomplish that or being able to meet all of the needs?
So we will screen as many days as there's demand, but the reality of it is, in the 6 screenings we've done between the nonprofit organization and then for this, we're only getting a 15% of students, and we are setting a goal. We want to screen every student. So eventually, we'd love to screen the freshman class on one day, depending the size of the school, and then eventually maybe the junior class, depending the size of the school. So we kind of get every student as they come through. But we have thought about that. And university screening, this will be our first one. So I think what we'll do is offer a screening day. If the demand presents itself, we will come back as many days as there are students who would like to be screened.
And did you say there's a nurse, a medical professional that will be at each of the screenings, or is it?
We have the technicians that administer the tests themselves are nursing students that we've partnered with at Worcester State.
Yeah, that you don't have to be
Right.
certified
Right.
to put them on, to read them, you do.
To read,
Right,
right.
which our cardiologists.
But just
have,
in
of
terms
course.
of comfort level for, if you have a high school student coming, I don't know what their.
Yeah, they're
comfort
graduate.
level
They're PA students.
yeah.
They're
Yeah, that's fine, just somebody who at least is in the field.
definitely.
Yeah.
Yeah, make them feel comfortable. And
Right.
That's a good point.
How are you guys incorporated? Because you got a ton of liability.
Yeah, so we're incorporated as a benefit corporation, so as a part of that, which is kind of a new structure. So basically, it's essentially an LLC, but the goal is not to maximize shareholder value, it's to do good in the community. So what we've committed to is giving 10% of our revenue back to Live for Evan, which is, like I mentioned, a nonprofit, also in the cardiac space that Jack and myself founded in honor of our friend Evan. We give back to that as a part of a benefit corporation, but also we are fully insured. We have general liability,
Cyber insurance.
professional insurance,
Professional insurance.
liability.
How much liability insurance do you have?
I think it's like 2.5.
Yeah, something like that.
Yeah,
Yeah,
yeah.
yeah. We worked with.
We had to.
We worked
Yeah,
with
yeah,
somebody
it's
who.
expensive.
Yeah, right. So we understand that we're in kind of an innovative field, so we realize that we have to cover ourselves.
Did everybody signs a waiver that says
Yeah.
it's not a diagnosis,
Correct.
it's just a
Correct.
screening?
It's just
Yeah,
a
that's
screening. Their
correct.
parents sign. So unless you're 18, we have a guardian sign, and then everybody over 18
And
signs.
then the mechanism is if a doctor sees something that does this 15-minute read, he sees something, then they make you follow up, or how do you guys
So
make sure that patient goes?
if there's an abnormality that gets detected, the cardiologists themselves, and this is in our agreement that we've signed with them,
Okay.
will call the parents themselves.
We
And
tell
let-
the school administrators too, so they have a fiduciary duty to make sure that student is properly not playing basketball, not participating in drama anymore. They're getting follow-up.
And then anybody who comes back normal, we have a templated email that we end up sending out. We have sent out to the parents to say basically, this snapshot of your son or daughter's heart came back normal. No further action is required. And we emphasize that it's a snapshot in time because to your point,
Yeah,
it's a 15-second.
Small window.
Yeah, exactly.
And you guys have run all that through liability lawyers and everything, all what you're sending out?
We have, yes, we have.
What is the cost of your premium?
Where are we at this year? It's
I'm not sure, to be honest.
It was expensive for us, for a startup.
Oh, is it a couple?
It
Sorry.
sunk us.
Of the total?
Yeah.
It was like I believe it was about 6,500, I believe.
500.
I believe. Yeah.
And is that, how many people does that cover? Like, as you have more people or more screenings, will that go up? Is it based on
No.
just an overall
Nothing.
flat amount?
Right now it's a fixed cost until we want to jump the premium up. So if we want to get
Okay.
to
Yeah.
the point before like a $5 million policy,
Mhm.
then we'd kind of jump it up. And I think we are going to consider that as we scale and as we find volume. But
You're right.
for now, that was our lowest barrier of entry that anybody would take our underwriting at. So we are kind of left for them.
Great.
Thank you
guys
guys. We
very much
appreciate
for
the
your
time.
time.
Yeah, it was
Appreciate
great.
it.
Thank you.
You guys gonna be downstairs later?
Yeah, absolutely.
Down Chowgate.
Oh, that'd be great. Yeah.
Thank you.